Today in series of Docplexus KOL interviews, we have with us Dr. Ajit Bhagwat, who is an interventional cardiologist at the Kamalnayan Bajaj Hospital in Aurangabad. His area of expertise is in heart failure. Thank you so much, Dr. Ajit, for this interview. So my first question to you is, there's a new drug called ARNI for the treatment of heart failure. Can you please elaborate on the same?
Yeah, this particular drug ARNI, it's an abbreviation, ARNI. Is recently introduced for last couple of years in treatment of heart failure with reduced ejection fraction. The word ARNI stands for Angiotensin Receptor, and NI stands for Neprilysin Inhibition. So it's a combination of two drugs. One is an Angiotensin Receptor blocker, and the second is a Neprilysin Inhibitor. This drug was tested in a very large randomized trial, which was conducted in over 8,000 patients and was published in New England Journal of Medicine about 2 or 3 years ago. And the important thing was this drug showed a very significant benefit over and above the conventional treatment of heart failure, which consisted of ACE inhibitors, mineralocorticoid receptor inhibitors, and beta blockers. So the results of this trial were so robust that the various guidelines had no hesitation in putting this drug on the top when you are treating patients with heart failure with reduced ejection fraction.
Right. So next, moving on to the next one. So doctor, what is the prevalence of this drug in India? Like, can you predict the prevalence in India? Like in the Indian scenario, basically. Prevalence
of this particular disease, you mean? The prevalence of disease of heart failure is very high. You know, you see a large number of patients with heart failure in your clinical practice, and the most important thing to remember is the mortality of heart failure is very high. It's like mortality which you see with cancer. So many people compare heart failure with reduced ejection fraction with cancer, right. And that's why you know, these patients need a number of drugs for its treatment. And even with a number of drugs which have come up over a period of time in last, I would say 25-30 years, the mortality of heart failure continues to be significantly high, and every new drug which comes and which has been approved for treatment of heart failure has moved this morbidity and mortality you know, to lower to some extent. It has, right. we were able to lower the mortality and morbidity to some extent. So until 10 years ago, the last major advent, the major breakthrough in treatment of heart failure took place almost 10 years ago, right. When the mineralocorticoid receptor inhibitors like spironolactone or eplerenone, they were proven to be beneficial in treatment of heart failure. And this was probably in 2003-2004, and after that, you know, for almost 10-11 years, nothing was on the horizon which would further reduce the morbidity and mortality of heart failure. Right. And this particular molecule ARNI, which was studied in this large trial called paradigm trial, we literally produced a paradigm shift in management of congestive heart failure. Okay. So this particular drug has been introduced for last 2 years, and this will have a very strong place in management of these patients of heart failure with reduced ejection fraction.
All right. Okay. Thank you so much, doctor, for this interview. It was a pleasure having you here.